Hi everyone, I am Dr. Niharika. I head the Department of Emergency in Manipal Hospital, Sarjapur Road. Today we are going to talk about a very important topic, which is choking. Choking is when an object gets stuck in your throat or in the windpipe. So it could be food particles, it could be toys. It is basically an emergency because if you do not remove that object, the patient can stop breathing. So the signs and symptoms of choking would be the patient cannot speak because it's stuck in your throat. The patient has excessive drooling of saliva. The patient cannot breathe. The patient can have a cardiac arrest itself. Those are the signs and symptoms of choking. When you see a person is choking, go to them and ask them if they are choking. They'll usually nod their head if they cannot speak, or they might have a very soft voice or a squeaky voice. The first thing that you should do is call for help. If you know the Heimlich maneuver, then you can start giving the Heimlich maneuver. In some cases, you can ask them to cough it out, because the foreign object would be at the back of their throat, and some people can cough it out if they're able to speak properly. The Heimlich maneuver is basically you go around the patient, you go and encircle your arms at the junction where the chest stops and the abdomen starts. You make a fist from one of your hands and encircle the other hand on top of that fist, and you give upward and backward thrusts. So basically, you are increasing the pressure in the chest of the patient by applying pressure from outside so that they are able to take the foreign body out. That is the Heimlich maneuver. In cases of pregnant females, you cannot encircle your hands on the abdomen. Go on the lower part of the chest and repeat the same as described before. In pediatric population, if the child is as the same size and height of an adult, you can do the same process. But if the child is shorter in size, then you have to kneel down behind the child and do the same process. If the child is less than 1 year, you would sit on a chair comfortably. You would take the baby in your hand and you will turn the baby back. You will give 5 back slaps using the heel of your palm between the shoulder blades. That's where our spine is. So you will give 5 back slaps, turn the baby and give 5 chest thrusts. How do we give 5 chest thrusts? By 2 of your fingers, your index finger and middle finger. So you would continue doing that 5 and 5 back slaps and 5 chest thrusts. Every time you turn the baby for the chest thrust, you would inspect his or her mouth for the foreign body. If you can see the foreign body, you would take it out through your hands. If you cannot see the whole foreign body and only a part of it, please do not attempt a blind sweep. If you attempt a blind sweep, the foreign body might go further in the airway and cause more problems than already is. You would continue this till the child loses consciousness or stops responding. If the child loses consciousness or stops responding, you will make the child lie flat on a firm ground and continue your CPR. The same goes for the adults. If you have another person, they'll take over the CPR, and every time you give breaths, that is 30:2, 30 compressions and 2 breaths. You would continue this till you get the foreign body out.